All right, welcome back to the Elias Macko Show. Now, a 42-year-old man who has lived with unbearable suffering, as he puts it, for 20 years and who has tried a multitude of treatments wants to die. He's fighting to obtain medical assistance in dying after a refusal by the CHUM, the hospital. Over the past 20 years, his suffering has prevented him from having a normal life. He has sustained back injuries, moving heavy tables in 2004, and since then, it has been difficult for him with pain and the use of opioids, relentless use of opioids. Dr. Georges L'Espérance joins us online, president of the Quebec Association for the Right to Die with Dignity. Dr. L'Espérance, welcome to the program.
Thank you very much, and have a nice day, you too.
Yes, so let's talk about how these decisions are made. If someone wants access to medical assistance in dying, how does a doctor determine whether or not to go along with that request?
Well, the first thing is that the person must encounter the criteria, which is to have a grave and incurable disease. Well, I don't speak of that person specifically because I don't know him and I don't know the file, of course. But normally, a patient with a chronic pain syndrome could be eligible to medical aid in dying, but with certain conditions means that that person must have tried at least many treatments and many years of treatments. And if anything works for him, well, that person may be eligible to medical aid in dying. And beside that, the other criteria are that that person must be in a decline, irreversible decline, and also suffering. Well, suffering with that kind of problem is evident, but the decline also must be evaluated. The only thing in chronic pain syndrome that is causing a little bit of problem for some doctors is to evaluate the importance of the pain. But the only rule, I would say, is to listen to the patient and listen to all his history and try to see in his file how long does that pain is on, from how many years does it goes on, and also what kind of treatments have been done before that. So that's all I would say the global aspect of the patient that must be taken in charge.
Does age matter in this? You know, well, the one thing that was striking to me is 42, right? And that seems rather young.
Yeah, it's pretty young. But in fact, if he's suffering since 20 years, well, nobody wants to suffer for 20 years. Should it be 42 or 62 or 82? Of course, when somebody is as young as he is, well, I would say the study of the file and of the person will be probably really more in depth. But normally it should not be an objection per se.
Yeah, and when someone is seemingly they're lucid, there's no mental health issues, and they are saying, you know what, I've thought about this, and this is what I want. I'm just trying to think about if how it stands now in Quebec, if that is enough for a doctor to say, okay, all right, this is what you want. You should have it. I'd love to know your take on just how you, because he says he's in pain, but he's been refused, right? So
well, what I read is that it has been accepted by one doctor and refused by the other one. But we don't know if it's the first, what we call the first opinion, the first advice, which is the one who will give the care. Normally, if the first doctor, what we call the first doctor, is the one that will give the care, if this doctor refuses the patient, well, normally it stops the process. But what we don't know in that case, if is it the first doctor or the first one or the second one who refused it. So that's what we don't know. But anyway, a patient has the opportunity to ask for a second opinion. Of course, not doing going to see a lot of doctors or nurses, but at least anybody should have the perspective to have another opinion, as it is the right of in every part of medicine to have another opinion.
We're with Dr. Georges L'Espérance, president of the Quebec Association for the Right to Die with Dignity. We're talking about some cases of medical assistance in dying. Dr. L'Espérance, are you happy overall with how MAID, medical assistance in dying, is treated right now in Quebec and what we have in place in this province?
Yes, I think we have a pretty good process. In fact, it's going also pretty well in the rest of Canada, outside Quebec. The next step will be to have access for major minors, which has a cancer, and also with mental health diseases. But it will take many years before that, because what we see is that the government will change in the next month. And we need to have some progressive government to go there. But many people are ready to go forward with mental health disease. The other problem in Quebec, as it is in Canada, in fact, is that it's not the same access to everybody to have a opinion on medical aid in dying when the patient asks for it. But it's going really better than it was. Let's see, 6 years ago.
What do you say to someone who says that it's too easy to get medical assistance in dying?
That's not true.
Not true?
That's absolutely not true. This is misinformation. All cases, every cases, 100% of cases are studied by the Commission des soins de fin de vie, end of life commission. And the doctors, to have medical aid in dying, you must have the opinion of two doctors, or even now, two nurses, and there's also the pharmacist who is in the process and all that. So there's a lot of people going on there. So it's really not easy. The opponents will say that, but the opponents wouldn't want to have any kind of medical aid in dying. So that's not true. That it is too easy, and you can see with that man. Perhaps I don't know him. I don't know that person. I don't know his file. But for him, for sure, it's not easy. And perhaps if he is seeing another doctor, well, perhaps he will be eligible.
And maybe there's another way of talking about this, because I would tend to agree with you, right? And this is a good example, this case that we referenced off the top, of someone getting refused. The one thing that I have seen where I go, and I've, from the start of this debate in this country, I've always been a proponent, if you have a serious terminal condition, you should have the right to choose when you go and how you go. But I've seen stories where people say they're not the ones bringing it up. They go to a doctor, they go to a healthcare professional, and it's being suggested to them. What about that aspect? Because I think those are two separate things. If someone is the one bringing it up and the one that's seeking it out, all in favor. But when I've heard stories of people being offered it when they've never brought it up, I don't know how I feel about that. I wonder if you have an opinion on that.
Well, my opinion is that, first of all, these are anecdotes, so we don't know the reality. Yeah. But for example, if you have a cancer, you see a doctor, they will tell you, well, you can have chemotherapy, radiotherapy, or you can have no treatments at all, or you can have palliative care. Medical aid in dying is a care. So if a patient just say to you, well, I don't want to have any treatments because I'm in the end of my life, I don't want to have any treatment. Okay, sir or lady. So would you like to have palliative sedation? Would you like to go to palliative care? Would you like to have medical aid in dying? It's our duty to offer the patient all the treatments that are available for him. So I don't have any problem with that. Of course, if you have a broken leg, and we will not offer you medical aid in dying, of course. But in those cases where the patient is with a incurable disease, well, I think it's our duty to offer them all the treatments that are available. And if that person doesn't want any treatment, well, you may have palliative sedation, you may go to palliative care, you may have palliative care at your home, or you may also look at medical aid in dying.
Well, Dr. L'Espérance, one thing is for sure, we will continue to have these discussions on this show, and I think in society, about how we do medical assistance in dying. Real pleasure to talk to you. A lot of great insight. Thanks so much.
Thank you very much. Have a nice day.
You too. That's Dr. Georges L'Espérance. He's president of the Quebec Association for the Right to Die with Dignity.